Okay, so let's start about talking about teaching principles and things you must include in your teaching stations. Please stay muted just unless you want to talk because it can bring some noise. So whenever you want to teach any students and they bring one station each exam, so it's kind of checking your teaching skills. So you have to remember to be clear about your objectives. So always introduce, first I will ask the students after building a rapport with them, and how are you and how is everything, how are you coping with the studying here, maybe it's medical students with the lectures and rounds here in the hospital. Do you need any help at all? Please come to me. So try build a rapport before starting your teaching sessions. And when you want to start the teachings, give overview about what you want to teach. Like, for example, let's see, this is ECG station. So you tell them, first you ask them, do you have an idea about the ECG and what exactly you want me to teach you in this session? So you will tell you, doctor, I know nothing about ECG. In all the teaching stations, they will tell you, I don't know anything. I'm starting from scratch. And the next question, you will ask them, what exactly you want me to teach me? So you'll tell you, please teach me the basics, how to read ECG. I know how to connect the wires on the patient, but I don't know how to read the script. So you'll tell them, yes, it's my pleasure to teach you. And we're going first in this session. So just say your overview about your teaching, like what you're going to cover as broad lines. Like I'm going, for example, to teach you, to introduce you to the ECG parts, for example, or waves, as you want to say it. And I'm going to teach you how to read the rate and rhythms. And in the end, I will finish by giving you some few examples about, for example, emergency ECG and how to read them. Okay, so just give introduction, what you're going to teach, because in this country, this is what must be done. Like if you want to teach anything, you have to make them ready what you're going to teach them. Like you be mentally prepared about what upcoming is these sessions, and plan what you're going to teach to give it structure. So our planning will start from today, like what the sessions are coming, and you need to plan what you're going to cover in your teaching in these stations. And there is no wrong or right answers, wrong or right approach. The most important things is your teaching skills rather than the information inside. Whatever you're saying, as far as it is correct informations, so it shouldn't be a problem for you. Whatever you want, for example, if you want to explain the waves or you don't want to explain the wave, if you want to give example about, for example, MI or atrial fibrillation, or you don't want to give at all, so it's totally up to you. But the patient wants the basics, so you start from the basics, and especially the rate and rhythm you have to cover. But the most important part of the teaching process itself is the structures you do for your teachings. Like it has to be organized by starting by this giving overview, what you're going to cover, and start explaining according to the structure. Like according to your introduction, we're going to go into details. For example, if it is procedure, we will tell for any procedure, so there is something to prepare before the procedures, and I will cover with you what we're going to do inside the procedures. And for example, there is some things that we're going to do it after we finish our procedures, like for example, labeling the sample, send it to the lab, or whatever you want, or a specific test you need to do. So it depends on the stations, but it has to be structured, and you have to move from steps to another, and you have to signpost when you move to the other steps in your teachings. So now I'm going to discuss with you, for example, about the ECG rate. Now I'd like to move on to the rhythm. So give it structures and tell the patient, now I'm going to start this part and try to explain. You can use paper and pencil as well. There is paper and pencil inside the cubicle in the table in front of you, so you can draw for the patient. It will help you to convey your message better. And during your teachings, you have to speak clearly and don't use any medical jargon, despite the fact that they are medical themselves, but make it simple. And also try to make it interactive sessions. So ask the student. So obviously the student told you, I know nothing about this station. Please teach me from scratch. So they don't know about the ECG itself, but you can ask them, for example, to calculate the rate with you. For example, doing ECG rate, for example, we need to calculate. After you explain it, just let them do the mathematic part. Like, for example, if we have between R and R wave for big squares, we divide 300 by 4. So ask them, what is so 300, can you tell me what 300 divided by 4? So the idea is just to get them involved, and you can ask them very basic questions, but to make them alert and awake and enjoy teaching. So you have to ask them, but don't ask them difficult questions, but you have to ask them many times through the teachings to get them with you, and also keep checking them out. Am I making sense to you? Is everything clear so far? If you want to ask me any question, please feel free to interrupt me during my teachings. I will be more than happy to repeat back for you. Does that make sense? Do you want me to repeat that? Can I move on to the next step? So always make it like this throughout your teachings. This is extremely important, and you can finish with, he said, give relevant examples. So it's always extremely important to explain things rather than just read it, because what is the difference between teacher and a student? So I have this information in front of me. So as a teacher, I will explain be clear about your objectives, as I said now. So you have to explain, but the student will read the steps, be clear about your objective, plan what are you going to do, give it structures, be interactive, try not to do. So some people do teaching like this, they teach BLAB 2, but teach is like without explaining anything. So this is also not going to increase your marks. So whatever you're saying, even if you said a little, you didn't cover too much in the station, it doesn't matter for them that much. What matters, it's the way you teach, the way you explain, the way you get the student involved, the way you check understanding throughout the station. So put these things in your mind before you teach any stations, and try to prepare from outside. This is the only station you can prepare from outside and not be surprised inside. So you, from outside, you have 1.5 minutes. You can think about what you're going to teach. So for example, for me in my stations, it was ECG teaching. So I forgot how to calculate the irregular rhythm. I know this 300 divided between the number of large square between R and R wave, but the other calculation it just slipped out of my mind all of a sudden when I was preparing outside. So I skip it from my teaching. I don't want to appear that I'm hesitant. So anyway, so just try to, and so I had in my first exam, I had 2 exams. In my first one, I had perispeculum. So I'm giving you today the 2 stations. So perispeculum, I wasn't aware of the details inside. I didn't, honestly, when I went my first exam, I didn't practice at all, like zero, because I was doing master degree at the same time. I had to submit a papers on the exactly same times. So what happened, I just read the history structures, few things to help me. So before exam. So what happened, I just gave my teaching structures and I was focusing on the IBS part in whole exam. I was focusing on the IBS part because this is my only the only weapon I have in my hand. So like I was in my second module in the master degree, so at least I know how to do this, to cover this part. So what happened, I got 11 in my first exam, despite the fact that I don't know too much information. Even I didn't mention about taking swabs, sending it to the lab, the type of smears they do for this perispeculum. I mentioned no things, and I got 11. They dropped me in the management one. In my second exam, it was ECG. I got 9, despite the fact that I know everything about ECG. Even I did advanced life support and this, so I know very well. I read ECG book. So because I was just overwhelmed with all the information I have, I was focusing on what I saying. I wasn't focusing on the students themselves. That's why my mark went down to 9. So this is something to teach us a lesson. Just we have to show teaching skills rather than be distressed about time management. I need to cover all this and there is not enough times. And when you hear 6-minute bell rang, your heart will be pumping and things going to be ruined. So focus on your teaching skills, teach nicely, make it structures and make conclusion, introduction, conclusion. It will improve your marks dramatically. So let's teach. So don't worry too much about the information, just teach me anything. So let's start by